Sexual health is a vital aspect of overall well-being, yet it remains a topic often shrouded in silence, especially among older adults. Despite the fact that individuals aged 50 and above are still capable of enjoying a fulfilling sexual life, many find themselves grappling with questions and concerns that remain unaddressed. This neglect can often be attributed to societal stigma. The prevailing belief that sexual desire diminishes with age can lead to feelings of shame or embarrassment, making older adults hesitant to discuss their sexual health challenges. It's common for these individuals to feel isolated with their worries, believing they are alone in experiencing issues such as decreased libido or erectile dysfunction. Unfortunately, many doctors, whether due to their own discomfort, a lack of training, or the perception that these issues are not relevant for older patients, often skip this important topic during consultations. This oversight can leave countless individuals feeling unheard and unsupported. Addressing sexual health in older adults is not merely an act of kindness, but a crucial component of holistic medical care. By fostering an environment where these conversations can occur openly, we can help dismantle the stigma that surrounds sexual health in aging populations. It's essential that both practitioners and patients recognize the validity of these concerns, as they play a significant role in emotional and physical health. Engaging in discussions about sexual wellness can empower older adults to seek help, find solutions, and ultimately enhance their quality of life. It's time to bring this important issue out of the shadows and ensure that everyone, regardless of age, understands that their sexual health matters. Sexual health does not exist in isolation. It is intricately linked to the overall well-being of older adults. When discussing this topic, it is critical to consider both the physical and mental dimensions of health. Many individuals in their 50s and beyond encounter sexual health challenges such as decreased libido or erectile dysfunction, which can be significant sources of distress. These issues can stem from a variety of factors, including hormonal changes, medication side effects, chronic health conditions, or even psychological barriers such as stress and anxiety. The implications of these sexual health problems reach far beyond the bedroom. On a physical level, decreased sexual activity can lead to a lack of engagement with one's body and an overall decline in physical health. Sexual intimacy is not only a way to express love and care, but is also associated with benefits like improved cardiovascular health, enhanced immunity, and even better sleep quality. Regular sexual activity has been linked to the release of hormones and neurotransmitters that promote feelings of happiness and relaxation, which further contribute to an individual's vitality. Mentally, the ramifications of sexual health issues can be profound. A decrease in sexual activity often leads to feelings of loneliness and isolation, which can exacerbate conditions such as depression. Many older adults may wrestle with diminished self-esteem or feelings of inadequacy due to their perceived loss of attractiveness. The interplay between sexual health and mental well-being illustrates a deeper connection. When individuals feel good about their sexual health and intimacy, they are more likely to experience a positive self-image and overall satisfaction in life. Inversely, struggling with sexual health can create a vicious cycle of negativity and emotional distress. This highlights the importance of acknowledging and addressing sexual health concerns rather than leaving them unspoken. Understanding the multifaceted impact of sexual health can empower older adults to seek support and pursue solutions that can enrich their lives, enhancing both their physical and psychological well-being. The impact of reduced sexual activity on mental health in older adults can be profound and wide-ranging. Many may find themselves confronting feelings of loneliness that stem from this lack of intimacy. For instance, consider an older gentleman named Tom, who has been married for over 30 years. As he has aged, he has noticed a significant drop in sexual activity with his partner, primarily due to her health issues and their busy schedules. Over time, Tom begins to feel isolated within his own home, as the physical closeness he once shared with his wife dwindles. The absence of this bonding not only affects his romantic connection, but leads him to feelings of being undervalued and unimportant. Similarly, a woman named Linda experiences a decline in her sexual health due to the natural changes that come with menopause. Once confident in her sexuality, Linda now grapples with feelings of inadequacy and sadness, believing that her diminished libido signifies an end to her allure. This shift can prompt severe bouts of depression, as she sees herself in a different light compared to her younger days. Linda's experience is not unique. It reflects a common narrative among older adults who feel that their sexual desires have inevitably faded, leading to heightened feelings of low self-esteem. Mental health is intricately tied to physical intimacy. When sexual activity wanes, many older adults may feel locked in a cycle of negative self-perception. They may wrongly assume that their worth is diminished as their sexual function changes, leading to increased vulnerability to depressive symptoms. A retired couple may find it challenging to socialize, as they are hesitant to discuss personal matters about their intimacy, so they withdraw from activities that could enrich their lives. The emotional toll caused by this lack of interaction often amplifies feelings of loneliness. Individuals may not only miss the physical connection, but also the emotional support and companionship that come with it. This illustrates the profound consequences of neglecting sexual health. The mental ramifications can ripple through other aspects of life, affecting relationships and overall happiness. By recognizing and addressing these emotional concerns, older adults can start to reclaim their sense of self-worth and dignity, an essential step towards revitalizing their overall well-being. The physical health implications of reduced sexual activity in older adults are often underappreciated, yet they can have significant ramifications for overall well-being. Engaging in regular sexual activity is more than just a means of intimacy. It also plays a vital role in maintaining various aspects of physical health. For instance, studies have shown that sexual activity is linked to improved cardiovascular health. During sexual arousal and activity, the heart rate increases, enhancing blood circulation and promoting a healthy cardiovascular system. A 2010 study published in the American Journal of Cardiology found that men who engaged in regular sexual activity had a lower risk of heart disease compared to those who were less active sexually. This correlation underscores the importance of sexual health as a contributor to heart wellness. Additionally, sexual activity has been associated with stronger immune function. Regular sexual intercourse has been shown to have a positive impact on immunity, as it may increase the levels of immunoglobulin A, an antibody that plays a crucial role in defending against infections. In a study conducted at Wilkes University, individuals who reported having sex once or twice a week showed significantly higher levels of this antibody compared to those who had less frequent sexual experiences. This highlights an often overlooked aspect of sexual health, its potential to contribute to a stronger immune system, which is particularly important for older adults who may already face vulnerabilities due to aging. Furthermore, hormonal imbalances that arise from a lack of sexual activity can affect older adults' physical health. For both men and women, sexual activity stimulates the production of hormones such as testosterone and estrogen, which are essential for maintaining muscle mass, bone density, and overall vitality. A decline in these hormones can contribute to issues such as osteoporosis, reduced strength, and increased frailty. For men, lower testosterone levels can also lead to fatigue and changes in mood, while women may experience more pronounced symptoms of menopause, including hot flashes and vaginal dryness. By understanding these correlations, it becomes evident that sexual health should be seen as a critical element of a comprehensive approach to aging well. Encouraging open dialogues about sexual well-being can help older adults recognize the potential benefits of maintaining an active sexual life, not just for personal satisfaction, but for critical health outcomes that enhance longevity and overall quality of life. Despite the critical nature of sexual health for older adults, many doctors often hesitate to bring it up during consultations. One of the primary reasons for this reluctance is discomfort, both from the physician's side and the patient's. Doctors may feel unsure about how to approach such a personal topic, fearing that they might offend or embarrass their patients. Simultaneously, older adults may also be apprehensive about discussing their sexual health, believing it to be an inappropriate subject for the doctor's office. This mutual discomfort creates a barrier that prevents open communication. Moreover, some healthcare providers perceive issues surrounding sexual health as irrelevant for older patients, mistakenly assuming that interest in sex diminishes with age. This misconception can lead to a significant oversight of the emotional and physical needs of aging individuals. Further compounding this challenge is the fact that many medical professionals have insufficient training on sexual health topics, particularly regarding the unique concerns of older adults. This lack of comprehensive education in medical schools and ongoing training can leave doctors feeling inadequate in providing guidance or solutions for patients facing sexual health problems. As a result, these factors create a cycle of silence where important discussions are left uninitiated. Doctors may skip over sexual health questions entirely or provide minimal information if asked, leaving their patients with lingering uncertainties. This dynamic not only perpetuates the stigma surrounding sexual discussions, but can also lead to a detrimental impact on patients' well-being. When sexual health concerns go unaddressed, older adults may feel increasingly isolated and unsupported, impacting their overall quality of life. Acknowledging these hesitations within the healthcare community is crucial in paving the way for more inclusive dialogues about sexual health, ensuring that older patients receive the care and attention they truly deserve. Starting a conversation about sexual health with your doctor can feel daunting, especially if you are not accustomed to discussing such personal matters. However, it is essential to recognize that your health, including your sexual well-being, is a vital part of your overall care. Here are some practical tips to help you initiate these important discussions and overcome any potential embarrassment or hesitation. First, consider making a list of your concerns before your appointment. Jot down specific issues you want to address, such as decreased libido or erectile dysfunction. Having these points prepared can help you stay focused and ensure that you cover everything on your mind without getting sidetracked. When you know what you want to communicate, it can be easier to bring it up in conversation. Next, choose the right moment during your appointment to raise the topic. It might help to start the conversation with a more general health question, gradually steering it toward your sexual health. For example, you might say, "I've been feeling a bit different lately when it comes to my sexual health, and I think it's affecting my overall well-being." This can create a natural segue into a deeper discussion. Additionally, remember that healthcare professionals are trained to deal with sensitive topics and have likely encountered patients with similar concerns before. They are there to help you, and by voicing your worries, you are taking an important step toward improving your health. If you still feel uneasy, try bringing a trusted friend or family member along for support. Sometimes, having an ally by your side can lessen the stress of involving such a personal topic in the consultation. If you feel your doctor is not providing the space needed for this discussion, do not hesitate to speak up. You have every right to address your sexual health concerns. You can kindly remind them that this issue is significant for you and request that it be treated as a priority during your visit. Lastly, take comfort in knowing that this conversation is vital for your well-being. By being proactive about your sexual health, you are advocating for yourself and contributing to a larger cultural shift in addressing these often taboo subjects. Engaging in an open dialogue with your doctor not only empowers you, but can also pave the way for better health outcomes, helping you to reclaim joy and intimacy in your life as you age. When it comes to addressing sexual health issues in older adults, there are several solutions and treatments available that can help restore intimacy and enhance overall well-being. These options range from medications to therapy, as well as lifestyle changes, all of which can play a significant role in managing sexual health concerns effectively. It is crucial to consult with healthcare professionals before embarking on any new treatment plan, as they can provide guidance tailored to individual needs and circumstances. One of the most common treatments for erectile dysfunction is the use of oral medications, such as phosphodiesterase type 5 inhibitors. These medications can improve blood flow to the penis, helping to achieve and maintain an erection. Popular options include sildenafil, tadalafil, and vardenafil, which have been proven effective for many men. However, it is essential to discuss these options with a healthcare provider, as they can help ensure the medication is suitable given any existing health conditions or medications being taken. For those experiencing low libido or psychological barriers to sexual activity, therapy can be an effective solution. Counseling or sex therapy can address issues such as anxiety, depression, and relationship dynamics that affect sexual function. Often, working with a professional can help individuals and couples openly communicate about their feelings, desires, and concerns, thereby fostering deeper emotional connections that enhance intimacy. In addition to medications and therapy, certain lifestyle changes can significantly impact sexual health. Regular physical exercise, for instance, is not only beneficial for general health, but can also help boost libido and improve circulation. Whether through walking, swimming, or strength training, staying active can contribute to a healthier heart and better sexual function. Additionally, healthy dietary choices rich in fruits, vegetables, lean proteins, and whole grains can support hormonal balance and overall vitality. Moreover, incorporating practices that reduce stress, such as mindfulness, meditation, or yoga, can enhance emotional well-being and positively influence sexual health. Stress management is crucial, as high levels of stress can impede libido and affect relationship dynamics. Lastly, it is important to remind older adults that any new treatment should always be discussed with their healthcare provider. This ensures that all aspects of health are considered and potential interactions or contraindications are taken into account. By working closely with medical professionals, older adults can navigate their sexual health concerns effectively, discovering solutions that can lead to not just a healthier sex life, but an enriched overall quality of life. Addressing sexual health issues can lead to a multitude of benefits that significantly enhance the quality of life for older adults. One of the most profound improvements can be seen in mental health. When individuals actively engage in discussions about their sexual well-being and seek solutions, they often experience a renewed sense of self-esteem and confidence. For instance, consider the experience of John, a 65-year-old man who felt increasingly disconnected from his partner due to erectile dysfunction. After he decided to open up about his struggles, he sought medical advice and began using medication for erectile dysfunction. The result was not just a physical change, but an emotional resurgence. John reported feeling more in control of his life and was able to rekindle the intimacy he had feared was permanently lost. Moreover, when sexual health concerns are addressed, relationships tend to improve. Open communication fosters deeper emotional connections between partners, allowing them to share vulnerabilities and rebuild trust. This was the case for Sarah and her husband, who had grown distant due to changes in their sexual relationship. After attending couples therapy, they learned how to express their feelings and needs more openly, leading to not only a healthier sexual dynamic, but also a stronger bond. Additionally, the benefits extend beyond individual relationships and positively influence daily living. When older adults take steps to enhance their sexual health, they often report higher levels of overall satisfaction and happiness. The intertwining of emotional and physical well-being contributes to a more vibrant life, reflected in increased social engagement and participation in activities that once brought joy. Enhanced sexual health plays a vital role in promoting a more fulfilling and energetic lifestyle, allowing older adults to fully embrace their later years with vigor and enthusiasm. Emphasizing the importance of these discussions can potentially transform lives, reigniting passions, connections, and a sense of purpose. It's clear that sexual health is a critical yet often overlooked aspect of life for older adults. Understanding the links between sexual wellness, mental health, and physical well-being can empower individuals to prioritize their sexual health as an essential component of their overall quality of life. Now is the time to take action. Don't let hesitation or embarrassment hold you back from seeking the support you deserve. Remember, your sexual health is just as important as any other facet of your well-being. You have the right to discuss your concerns with your healthcare provider openly, and doing so can lead to meaningful improvements in both your intimate and emotional life. Consider starting a dialogue with your partner too. Sharing your feelings and experiences can strengthen your bond and open the door to exploring new ways to connect. Whether it's small changes in lifestyle, seeking professional advice, or simply being open about your feelings, each step you take towards addressing your sexual health can lead to significant positive outcomes. Now, we want to hear from you. Have you faced challenges regarding your sexual health that you found difficult to discuss? Or maybe you've successfully navigated this conversation with your doctor or partner. Your experiences can be incredibly valuable to others in similar situations. Please share your thoughts, questions, or suggestions in the comments section below. Engaging in this community dialogue not only helps you, but supports others who might be feeling alone in their struggles. Let's work together to break the silence surrounding sexual health in older adults and create an environment where everyone feels comfortable and empowered to speak about their needs and desires.